Hey everyone, welcome back for another deep dive. We often get questions from parents and caregivers, even just curious folks, really, about the differences between speech delay and autism.
Yeah, it's a topic that comes up a lot, and there can be some overlap, so it's understandable that people want to unpack that a little bit.
Totally, and that's exactly what we're going to do today. We found a great article called Speech Delay versus Autism, What's the Difference? And we're going to break down some of the key points.
It's a really helpful resource. It
Hmm.
gets into the signs, causes, and, all those things that people are wondering about, like when to seek help, what treatments are available, that kind of thing.
Exactly. So we're going to try to give you a really clear picture of those core distinctions between speech delay and ASD.
And hopefully equip you with the knowledge to feel more empowered, whether it's for your own understanding or if you're supporting a child in your life.
Okay, so let's start with the basics. What are we really talking about when we say a child has a speech delay? What does that actually mean?
Well, simply put, it means a child isn't meeting those typical language milestones that we expect for their age. And of course, every kid develops at their own pace, right? But there are some general guidelines that can give us some clues.
Okay, so the article gives us some really specific age-related signs to watch out for. Like, for example, between 4 and 6 months, it mentions babbling as a typical milestone. So if a baby isn't babbling by that age, is that a cause for concern?
Yeah, it could be an early indicator that speech development might be a little bit behind. Then, as they get closer to their first birthday, around 12 months, we usually start to hear those consonant vowel combinations like da, na, ma, and, those early gestures like pointing and waving. So the absence of those things could be another sign to pay attention to.
Right, and as they get older, those milestones become a bit more complex, right?
Exactly. By 18 months, we're looking for things like, can they imitate sounds? Do they have a few words? Do they seem to understand simple requests? Are they using gestures more than words to try to communicate? Those are all things to think about.
And then around 2 years old, they should be starting to follow simple instructions, putting two words together like mommy up, want milk, things like that. And they should have a vocabulary of at least 50 words by that point and, maybe starting to show some interest in playing with other kids.
Yeah, and it just keeps building from there.
Right. By 3 years old, we typically expect to see them using simple sentences, understanding basic grammar like plurals, and, being able to point to different body parts when asked.
And then by 4, they should be able to tell a simple story, make sentences of like 4 or 5 words, and start to use pronouns correctly like you and me.
So that's a pretty detailed progression, to kind of give parents and caregivers a framework.
Right. And what's important to remember is that there's a difference between a speech disorder and a language disorder, which the article talks about. Can you explain that a little?
Sure. So a speech disorder is all about the physical production of sounds, like how clearly someone can articulate their words. So, they might say thelp instead of soup or caw instead of car, like the article says.
Right, right. It's about the actual mechanics of making the sound.
Exactly. And then we have language disorders, which are a little different.
Yeah, language disorders are more about understanding and using words effectively,
Mm-mm.
the meaning behind them.
Right. And the article breaks that down into receptive and expressive language delays.
Yeah, so receptive language is all about how well you understand what others are saying to you, you know? Like, can you follow directions or grasp the meaning of what you're hearing?
Okay. And expressive language is all about how well you can communicate your own thoughts and ideas.
Exactly. So you might have a good understanding of what you want to say, but the words just don't come out, or you can't put them together in a grammatically correct way.
Okay, so now that we have a better sense of what speech and language delays look like, what are some of the common things that might cause them?
Well, hearing loss is a big one. And that doesn't just mean a permanent hearing impairment. It could be something like recurring ear infections that, even though they're temporary, can disrupt a child's ability to hear sounds clearly and learn language during those crucial early years.
That makes sense. I mean, if you're not consistently hearing the nuances of speech, it's going to be tough to learn how to produce those sounds yourself.
For sure. The article also mentions ASD and Fragile X syndrome, along with genetic conditions like Down syndrome, intellectual disabilities, and even things like brain injuries or being born premature or having a low birth weight.
So it's a pretty diverse range of potential factors.
It is. It really highlights just how complex our communication development is,
Yeah.
you know.
Absolutely. So let's shift gears a little bit and talk about autism. What are some of the early signs that parents and caregivers should be aware of, especially in younger children?
Well, one of the big ones is difficulty with nonverbal communication, like not understanding facial expressions or body language or social cues in general. And then also, inconsistent eye contact or not responding to their name being called. Those are things that often show up pretty early.
Okay, and what else?
Well, trouble understanding other people's feelings is another one. And then there's echolalia, which is the repetition of words or phrases, which can be a sign. And of course, delayed language development can also be a part of autism. But it's important to remember that it's just one piece of the puzzle.
Right, it's not the whole picture.
Exactly. The article also mentions things like preferring to be alone, having trouble making friends or playing social games, and repetitive behaviors like rocking, spinning, or flapping their hands. And also, getting upset by changes in routine.
So it sounds like alongside potential language delays, we're also seeing these differences in social interaction and behavior,
Right,
right?
exactly. Now, when it comes to what actually causes autism, it's important to understand that there isn't one single answer.
The research seems to point to a combination of genetic and environmental factors, right?
Right. Researchers are looking at things like genetic disorders, like Rett syndrome and Fragile X, which can be associated with autism. And they're also investigating environmental factors like exposure to certain viruses or pollutants during pregnancy, things like that. But the evidence is still emerging in those areas.
And it's crucial to emphasize, like the article does, that there is absolutely no scientific evidence linking vaccines to autism.
Right. That's a really important point to remember.
Okay, so now that we've laid out some of those characteristics of speech delay and early signs of autism, the big question for a lot of people is how do you actually tell the difference? How do you know if a child is just a late talker or if there might be something else going on?
That's a great question, and it can be tricky sometimes. The article points out that the core difference is this. Speech delay is primarily about difficulty with developing those speech and language skills, right? But autism is a broader neurodevelopmental condition that affects social skills, communication, learning, and behavior. It's a much bigger picture.
Okay, so it's not just about how many words they know or when they start talking. It's about how they interact with the world around them. So how does social engagement differ in a child with a speech delay versus a child who might be showing signs of autism?
Well, typically, kids with speech delays, even though they're struggling with the words, they still really crave those close relationships. They'll seek out connection with their parents, family, other kids, and they really respond to attention and will try to imitate what others are doing.
They're still very socially driven.
Exactly. But with autism, it can be different. Those social interactions can be more challenging, and sometimes they prefer to be alone.
So what about communication styles beyond just spoken words? How does that differ?
Kids with speech delays, they'll use all sorts of things to try to communicate, like body language, eye contact, all those natural ways of getting their point across. But with autistic children, those social communication cues can be tricky. Like we talked about earlier, they might use echolalia, repeating words or phrases, which serves a different function for them, and they might have less consistent eye contact or use gestures differently.
And the article also mentions differences in motor skills, right?
Yeah. So kids with speech delays might sometimes have a little bit of trouble with coordination, like using utensils or kicking a ball, but it's usually not a major issue. But with autism, while motor skills can be challenging too, you might see more of those repetitive movements, like hand flapping, rocking, spinning, things like that.
So those are some really helpful things to look out for. Now, for parents and caregivers who are concerned, when should they actually reach out to a professional for an evaluation? What are those red flags?
The article really stresses early intervention. Sooner the better. But there are specific milestones that should definitely prompt a closer look from a professional. Like if a baby isn't babbling by 12 months, or not saying single words by 16 months, or not putting two words together by 24 months, those are big ones. And also, if they don't respond to their name consistently, or if they actually lose speech or language skills that they had before, that's a really important sign to get checked out right away.
And what kind of professional should parents and caregivers reach out to?
A speech-language pathologist is a great place to start. They're the experts in communication development. You could also talk to a developmental pediatrician or an autism specialist. Speech-language pathologists can actually help with the diagnostic process too.
Okay, that makes sense. So let's say a child receives a diagnosis of either speech delay or autism. How can speech therapy help in both cases?
Well, speech therapy is all about improving communication skills, no matter what the underlying cause is. So for kids with speech delays, it can target things like speech sound production, fluency, and overall language development. both understanding and expressing themselves.
And what about for children diagnosed with autism?
For autistic children, it's still about those core language skills, but there's also a big focus on developing social communication skills. Things like taking turns in conversations, staying on topic, understanding nonverbal cues, all those social aspects of communication that can be really tough.
The article mentions some of the methods that speech therapists use, like games, activities, flashcards, making it fun and engaging for kids.
Yeah, they're really good at tailoring the therapy to each child's needs. Repetition is a big part of it, and they use all sorts of creative techniques to help kids learn and practice those communication skills.
And therapy can take place in different settings too, right?
Exactly. Individual sessions, group sessions, it really depends on what the child needs. And of course, the family plays a huge role too, creating that supportive and language-rich environment at home.
Right, it's a team effort.
Totally.
So, beyond speech therapy, are there other treatments that might be helpful for a child with autism?
Yeah, behavioral therapies, like ABA, are often used to work on those social, communication, and adaptive skills. And occupational therapy can be really beneficial too, addressing things like fine and gross motor skills and any sensory processing issues.
And I imagine the treatment plan is always very individualized, right?
Absolutely. Every child is different, so the approach has to be tailored to their specific needs and goals.
Okay, so when it comes to finding a qualified speech therapist, what should parents be looking for?
The article emphasizes finding someone who will do a thorough assessment, really understand the child's needs and work closely with the family to come up with a plan. And ideally, you want someone who has experience working with kids with speech delays or autism specifically.
Someone who really understands the nuances of those challenges.
Exactly. Like the article mentions connected speech pathology, as a provider with expertise in those areas.
So, as we wrap up our deep dive, it seems like the key takeaway here is that speech delay is mostly about language development, while autism is a much broader neurodevelopmental condition affecting social interaction, communication, learning, and behavior. And early intervention is really crucial for both.
Couldn't have said it better myself.
It's all about recognizing those early signs and getting support as soon as possible. And, as we think about the amazing ways in which communication and connection are intertwined, what other, perhaps less obvious differences might we observe in how children with speech delays and autistic children experience the world around them? That's something to ponder, as you continue to learn and observe.
That's a great thought to leave our listeners with.
Thanks for joining us for another deep dive, everyone.
See you next time.